The statin is helping that lipid-rich core shrink and also putting a thicker cap over that plaque so it seals it off.
Does heart disease cause erectile dysfunction?
Absolutely can. So the analogy is ED equals ED. So erectile dysfunction equals endothelial dysfunction and vice versa. So if guys are starting to have issues with erections, oftentimes it's a vasculogenic cause. They're not getting enough blood flow into the sexual organs to allow an erection to happen, and it's due to low nitric oxide.
When you see patients, how early does this seem to start?
ED can happen under 40, but it tends to happen more when people are over 50, 60 years old.
And do you treat with vasodilators, or do you use agents like Cialis as a cardiologist?
I do on occasion. It's kind of the canary in the coal mine question, is that if guys are having ED and they're asking for, the little blue pill or, sildenafil or tadalafil, it's not that it's a problem that they need to use those things, but it's a marker that they don't have good nitric oxide to begin with. And that's somewhat of the myth, is that these are not nitric oxide promoting medications. They just keep nitric oxide around longer. You have to get the nitric oxide, I call it, into the funnel. You have to be eating the greens. You got to be exercising. You got to be in the sun. You got to be taking the nitric oxide promoters into the system. And then the tadalafils and the Viagras, they just keep the nitric oxide around longer so that it has more effect on the vascular system.
That's fascinating. I didn't actually know that. And in my mind, that seems like there could be a great combination of, we use Cialis in our practice and tadalafil. If you use that in conjunction with beetroot juice or something like that, seems like that would be very helpful. And just a real nerd note, arginine increases nitric oxide.